Biztech's Asia's hottest startup show. Now, our guest today is Dr. Ramesh Rajentheran. He's the co-founder and CEO of MiyaHealth. Now, MiyaHealth is a SaaS health tech company which aims to reduce inefficiencies in healthcare infrastructure, especially related to payments. Now, to tell us more, welcome to the show, Ramesh.
Thanks. Great to be here, and thanks for the opportunity.
Now, Ramesh, for a start, could you give us an overview of MiyaHealth and what you do?
Right. MiyaHealth actually aims to solve inefficiency in healthcare. And the idea and the thesis really is that the world doesn't have enough resources to see all the patients or to pay for healthcare. And we believe that actually efficiency is the big theme in healthcare that will play out over the next 2 decades. So specifically, our products aim to reduce the inefficiencies that are present in the payer space, meaning that we try to make health insurance more efficient. We try to enable patients to know where to go to get healthcare, because that's another source of inefficiency. And finally, we enable hospitals to connect to insurers without humans, and again, reducing another source of inefficiency. But the core thing that we're really good at, the core IP that underpins all 3 platforms, essentially is our ability to harmonize and standardize healthcare data into a dictionary. That enables us to collect very, very granular details and very, very granular data. And then the products themselves are just a series of rules on that. And if you apply the rules to granular data, you can make insurance more efficient. If you apply rules to granular data, you can tell patients where to go, how to get care, and to follow up. And if you apply rules to granular data, you can also enable hospital machines to talk to insurer machines directly.
Now, on that note, I think it's important for us to give the audience a backstory about your very interesting background. You're a medical doctor by training, but you're also an investment banker. So give us a perspective of your journey as a Malaysian who then moved on a scholarship to Singapore, and then how that impacted you and leading you to founding MiyaHealth.
Yeah, that's actually ties to the #1 story. The #1 question I always get asked by anyone, investor or client, is why is somebody like you doing a startup? Because people in my background typically don't. People in my background run big companies. And to be fair, I have the CV of somebody who runs Pfizer, not that does startup.
Yes.
But essentially, I did medical school in the UK. I got really lucky. I found a way to treat breast cancer really early on. Published some papers, entered into a heart surgical program. So I was just about to become a registrar in cardiothoracic surgery in the UK. And then decided I really hated being a doctor. I didn't want to spend 40 years doing it. So I went back to business school, got an MBA from London Business School, and then became an investment banker. So for 12 years at UBS, Morgan Stanley, and Barclays in London, New York, Hong Kong, Singapore, I was a banker, but always around healthcare. So I spent my entire time either analyzing healthcare stocks. So I was a pharmaceutical analyst in Europe. And then I was a sales guy selling healthcare equities, mainly to hedge funds. And then I helped run $1 billion on a prop trading desk at Morgan Stanley. And then my last job in banking was, I was actually a managing director at Barclays in Hong Kong. And I built and ran the Asian healthcare business, which was mergers and acquisitions, mainly cross-border. So I'm also the only banker I know who's done research, sales, prop trading, and but always around healthcare. In 2015, I actually joined a client called Fullerton Health here in Singapore as CFO. To take them through an IPO process. The IPO process unfortunately was unsuccessful, which is obviously ironic as a banker who's done these things on the other side. But we ended up raising a substantial amount of money, about $650 million. We then did a roll-up. So we acquired 22 companies in 2.5 years. Became CEO as well as CFO. So I had to integrate 22 companies, which was a lot harder than buying 22 companies. And then, the company grew, right? We were 800 people. When I got there, we were 5,500 after 2.5 years. And then I took on a role to actually lead the IPO of that company in New York. And unfortunately, 3 months into that New York IPO process, my son, who was then 5.5 years old, lost his mother. So
Sorry to
essentially,
hear that.
thank you. Essentially, I mean, we were married for 17 years, went to the same high school. We were divorced by then, but he came to live with me and my new wife after, his mother died, which changed my whole world, right? So I had to resign 2 days after that happened because it was a very sudden death. And my kid comes first, right? I couldn't list a billion-dollar company and do this. So I felt I needed to be a stay-home dad for a bit. So that's what I did for 3 months. Then obviously after 3 months, my son was fine. I had to make a decision. I was too old. I was a bit too young and I guess a bit too poor to retire. So I said, okay, well, I got two choices. I can go be CEO of somebody else's company, which is what people like me normally do, or I can build a company to fix the reasons she died. And that's what I did. I basically started MiyaHealth with two co-founders to fix the reasons my kid lost his mom. And that's the
Sorry, go ahead.
Yeah, sorry, I was going to say that's the backstory to all the origin story of MiyaHealth. And to kind of complete the picture a bit, essentially she died because she saw the wrong doctors at the wrong time. And also she ended up in the wrong hospital because her health insurer messed up on a letter of guarantee. It took 4 hours to come and she checked herself into a government hospital. So it was a series of incidents that led to her passing. I believe that all of that could be fixed with technology, because if you have technology, we should be able to tell patients where to go, what help to get. And we should be able to solve for things like letters of guarantee, like why does it take 4 hours? Well, why didn't you do it in 2 minutes and send it to the patient's phone, right? So I believe all that can be fixed with technology. I believed I could raise the money. I believed I could form a team to build what I wanted. And that's how we started.
Now, problem statement very clear. Within the healthcare ecosystem itself, you have 3 product offerings, which is MiyaPayor, MiyaProvider, and MiyaPatient. Walk us through how each of them works, and then how do they work together, and how does that improve outcomes?
That's a good call. So MiyaPatient, as the name implies, is the first patient-facing thing, and there it takes the form of an avatar. So think of it as an app you pull up on your phone. If you're an insured member, you'll be able to do a triage. So you'll say, hey, I got a cough or cold. The machine will ask you a series of questions and kind of tell you what it thinks. It will say, okay, based on your insurance coverage, you're covered for a teleconsult or physical. Our recommendation might be, say, a physical visit. In fact, if you told it a certain cluster of symptoms, it'll call you an ambulance straight away. And the idea is that it saves insurers money to make sure that the patients end up in the right place and at the right time. And it's good for the patients, win-win, right? The really cool part is the machine then it proactively follows up. So depending on what happened, it will follow up and say, hey, are you okay? And then take you through this process again. If you're not, we can also use that same machine to help you manage your day-to-day issues around things like diabetes. So a lot of times diabetic patients don't know how to measure things like blood glucose, etc. And the machine kind of talks you through that as well. So think of it as everything you need to manage your healthcare and everything you need to know around your health insurance. So very consumer facing. It's still paid for by the insurer, but it is consumer facing. Right. So
and these are some of the and this is simple things, and as you were telling the story of what you really do, and from someone like me who's from a healthcare background, I already see the pieces of the jigsaw puzzle that you're solving, and I'm going to slice one little piece around patients and critical illnesses and chronic disease management.
Yeah.
Your app will probably tell them exactly when to take their pills during the day, because a lot of times they forget to take. It's as simple as that, but that improves recovery outcomes tremendously. Simple thing like that. Am I correct?
Correct. We're not trying to do the rocket science things with the product. We're actually trying to do really simple things because all of us go to the doctor. We forget probably 80% of what happened in the visit once we get home. And it happens to me, and I'm a doctor, right? I sometimes have to call the doctor and say, hey, bro, what exactly did you say about the bandage? And he go, your doctor, how come you don't know this? So
Yes.
it's really solving the very simple day-to-day thing. The big difference is that it's not a chatbot. See, chatbot is reactive. Okay, this is actually proactive. It actually figures out when it should engage. It sends you an SMS prompt. It calls you back. It figures out, hey, Easter's coming, and historically you've had terrible diabetic control around Easter. You know, hey, you need to measure twice a day now, not once a day. Right? That's the real differentiating feature of it. The proactivity.
Now, Ramesh, then that's the consumer side.
Yes.
Talk to us around the payer side, or for the benefit of our audience, the payers are the insurers and corporations that actually pay for healthcare.
Yeah.
Tell us about, share with us some customer stories or client stories around how MiyaHealth has actually helped your customers and made a difference.
Yeah, and this is the flagship product. We call it MiyaPayor. It actually also services TPAs, right? So anyone who pays a bill, right, either by yourself or on behalf of another party, right? Now, the idea here is that insurers, TPAs, even governments, anyone who pays for healthcare, there's a lot of humans involved in the process. So typically, they employ a huge workforce in things like the call center, a claims team, a network management team, etc. Now, these are processes that can be done better by machine, right? Leaving the humans to really focus on things like empathy, right? So the idea here is very simple. Can we automate as much as possible by collecting and managing very granular data? So essentially what we developed at Miya is a methodology around harmonizing and standardizing data into a dictionary. So think of it as an underlying language on which the machine can then act. And that's our core IP. And the idea here is very simple. I mean, in fact, when we sell this, we only have one line. It's literally for every 10 humans that you currently employ in a call center or a claims team or network management team, will enable you to do that same job with one human. And that's it. If for every 100,000 members that you manage, if you have to hire more than one person, you're doing it wrong. And that's it.
That's a solid value proposition for an insurer or TPA and so forth.
Yes, and especially in this region, because not a lot of people know this, but health insurers actually operate on very thin margins. You wouldn't know it to look at the premium, but the margins are actually quite thin. And we're talking.
But that's also a function of, in many markets, healthcare cost escalation and healthcare inflation being in double digits every year in private health.
In part, but equally, they typically spend 10% of every premium dollar on administration, which is where we come in, right? And the idea is very simple. If we can automate it. So that's part one. Now, part two of that is, hey, if we have really granular data, that will enable you to measure risk, which is your job as an insurer. And if you can measure the risk accurately, you can price the risk accurately. And hopefully that leads you to tighter pricing around premium, so making it more affordable, but equally also offering the health insurance products to older people, for example, where previously you would have thought that's too risky to cover. And that's part of our mission, right? Part of our mission is, yes, we want to ensure that broader coverage for a bigger slice of the population by collecting that granular data that helps you to measure and price risk. So two parts. One is efficiency, taking the humans out of the equation, improving your margins. The second is really the measurement and pricing of risk, which hopefully leads to better products for more people.
Ramesh, you and your team have a gold standard background, yes. which obviously has helped you raise money, and we'll talk about that shortly. But in your journey, since you started the business, what are some of the challenges that you faced and how have you overcome them? Because healthcare, and particularly insurance, are two industries that are, for lack of a better word, laggards in terms of technology adoption.
Yeah, Legacy is being really politically correct, by the way. Some would call it ossified. Yeah, some challenges. Look, our timing wasn't ideal when we started the company, quite frankly. I mean, we started June 2019, just before COVID. And then COVID hit us before we even had a chance to build a company or raise all the money. So we actually had to finish the fundraising, try to build a company during COVID, which was really challenging when you're young, and you have a distributed workforce, like we did. So not a lot of people know this, but our development hub is actually in KL, even though we are a Singaporean company.
Okay.
For various reasons, which we can also talk about.
And that's a huge, that's an easy, we're a technology-based show.
Yes.
I think many CEOs have talked about the cost advantages of labor market arbitrage around Malaysia. Same people, but 1/4 of the cost of Singapore when you include real estate cost and infrastructure cost.
I think it's more than that. Actually, it's work attitude, it's work ethic, it's also creativity and resourcefulness, which actually are things you associate with Malaysians more easily. I'm saying this because I'm partly biased, obviously. I actually do believe it. It's not just about costs. When people ask me why, I also say it's all these other things. But so challenge number one was obviously trying to do all that, and when we didn't have any money and, everyone had better things to worry about, right? During the pandemic. Challenge two was really, you always have the idea of what you want to build in your head. Like, for example, MiyaPatient. And when we first told people what we wanted to do, they thought we were nuts. We were very lucky. We got an Enterprise Singapore grant to build a prototype.
Okay.
They thought we were a bit nuts, but we said, just trust us, we will get it done and we will build it. And, it got done. So the second challenge was really, how do you get ideas in your head and turn them into actual product? And there I got a bit lucky because my co-founder is just brilliant at doing that. It takes the crazy ideas in my head and turns them into a real product. So that was the second challenge. The third challenge is perpetually capital. And unfortunately, in this part of the world, the capital pool is not as deep as it is in the US, where I think we would have 30 funds. If we told them what we do, there'll be 30 funds who just got it within 2 minutes about what we did because they just specialize in that little thing. They even have funds that specialize in fintech, insurtech / health tech, meaning they only do those two things, right? And we sit at the nexus of both. So I think capital has been the biggest challenge, and it will continue to be the biggest challenge. Everyone always asks us about people, but to be honest with you, people has always been our easiest solve. We've never struggled. I don't think we've ever made a job offer to somebody and they've turned it down in like 4 years that we've done it. And I think that's because people want to work for people that they trust and they like and they respect. And I think my two co-founders are very, very good. And I think people want to work for those two. So we've never had a people problem. It's always been, capital. I think that's just still the biggest issue that we've had.
But you've solved this problem with capital. In fact, in a tough market like this, you just closed the pre-series A round last year of 10.4 million. Tell us about that and what synergies ST Engineering brings to the table.
Yeah, so we have an interesting cap table. I've raised, okay, first of all, take a step back. I've raised a lot of money in my life as a banker. And then when I ran, bits of Fullerton, I probably raised, I don't know, 10, $20 billion. Maybe I stopped counting, right? I've done 55 M&A deals. But I will say that the 10 million that we've raised at Mia is the hardest 10 million I've ever raised in my life by a country mile. Because you're trying to initially raise it based on a concept, an idea, and not a real product, right? And then once you have the real product, the question is, can you get the traction? Can you build a commercial traction, especially how quickly can you convert an insurer, etc. So it's not been easy by any means but I would say that, we've been a bit fortunate to get the investors that we have. And I like to say that we have one of each. So we have ST Engineering, which is a strategic technology company. We have a deep tech VC called Elevate, because a lot of what we do is machine learning, especially around the taxonomy, the dictionary. We have a health tech VC called HealthX, which is part of Jungle. We have a fintech investor called Central Capital, which is part of BCA in Indonesia. We have a Swiss foundation called Foundation Botna, because of what we do, broadening healthcare access. And finally, we have Enterprise Singapore. So we literally have one of each category. And the reason being is because we don't sit squarely in health tech. A lot of what we do is around the financing of healthcare, working within an insurer, etc. So the truth is we're somewhere between an insurtech and a health tech. And that's why we have that mix of investors that's quite broad. In terms of ST, they are our largest investor, actually. And obviously, they're a strategic investor. ST, actually, their core competence is really around data, enabling machines to talk to each other, because that's what modern defense is. And they're very big in defense, as you know. So they see us primarily as a data play, because again, our expertise is how do you harmonize and standardize healthcare data into a common language. And that's the synergy. It's just that we do it for healthcare and we have the domain expertise, whereas they have a much more broader kind of expertise around that same process. So we effectively work with them to develop products. So we have a third product we haven't talked about called MiyaProvider, and that was co-developed with them. But they're also financial investors, so they're the second largest shareholder.
Now, looking ahead, you now have the capital to recognize the vision, to execute. What's the strategy for 2024 and beyond? You're a Singapore-based company, but you've rolled out in several countries in Southeast Asia. Give us a snapshot of what your plans are like in the next 12, 24 months.
Well, we always need capital, so we're raising some more because obviously there's always more to do. We have a longer sales cycle than most because we obviously deal with insurers and it takes time to bring on an insurer. Most of our contracts are 5-10 years long, which is, I know, unusual for a startup. We get asked a lot about it. But because we do core infrastructure, the systems that sit inside of insurers, it's a longer term contract business. So the good and bad of that is it's good because you have visibility on income for 10 years at a time. Bad because it takes you a bit of time. So you always need capital to kind of bridge that working capital requirement. So part one of the plan is, yes, raise again. Part two is we need people. So we really are, trying to hire technologists, data scientists, etc., because we still see a product roadmap ahead to improve and to deploy. Number three is do commercial partnerships. We are still a very small company. We only have 22 people. And even to penetrate the core markets of Indonesia and Philippines, we just need more bodies. But we also need more partnerships because the fastest way to expand globally is to do a partnership with another tech company, with the systems integrator, where they will act as our commercial agent. They will go open doors for us, and they will also help with the deployment. So because the long-term goal of the company is that the business model should be similar to an SAP, where, SAP don't sell SAP and they don't really deploy SAP.
They work with partners.
Work with partners. And that's the only way for us to really expand globally, because there'll never be enough capital to hire, the 10,000 people you need to really take this global. So it's really around partnerships, because, the issue that we have primarily is that we have a big product in a small company, right? So the idea is we need to kind of match that in terms of commercial and integration presence. So that's really the third focus, right? So number one is capital, number two is people, number three is commercial partnerships.
Ramesh, it's been a fascinating conversation. I'm looking forward to tracking your progress over the next 2 years in particular. But before we leave, any final thoughts you'd like to leave the audience with?
I think, it's, if I could leave you with something, we're excited about our space because we think health insurance will grow. We think the coverage gap is real. We think, in a nutshell, somebody needs to pay for healthcare, and it's becoming too unaffordable for somebody to pay out of pocket, which means that if, private health insurance will grow in some shape or form. And we're really excited to be part of that, enabling more people to get more coverage And that's something we're pretty keen on. So always open to hearing ideas from different people. It can be people from different industries as to how to enable that to happen. And yeah, really, really excited about the space.
Ramesh, thank you very much for taking your time to be on the show. It's
My
been
pleasure.
enlightening.
My pleasure, and thanks very much for listening and for the opportunity.
Now, we've been speaking to Dr. Ramesh Rajentheran. He's the co-founder and CEO of MiyaHealth. I'm Brian Fernandez, and you've been watching and listening to Biztech's Asia's Hottest Startup Show. This interview will be on our website, www.biztech.asia, as well as our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.